I really enjoyed our last discussion. And our last discussion was more you interviewing me, but I wanted to flip that around this time and get to know more about you. I really enjoyed meeting other Bitcoiners in the healthcare space, and meeting you and finding out about your background in health policy is really fascinating to me. In medical school, we got a little bit of teaching about health policy, but I'm really excited to talk to you more and find out more about your experiences with health policy. But why don't we start with you talking about how you got into Bitcoin?
Yeah, thanks so much for facilitating this discussion. Always a pleasure to chat with you. I first went down the rabbit hole, say 2021, just after the pandemic started. I am a professor and at the time was leading a graduate MPH program, generalist in focus. So we had interdisciplinary learners from nurses to doctors to straight from undergrad, studying public health and also living through one of the greatest health challenges we've experienced thus far. And so this really made me think of just several things in trying to support these students as they were learning in the program. And in addition, personally, trying to figure out what's going on, what's the best personal protection actions to take in the whole environment that we're in. And ultimately, it led me to think about, and I mentioned this before in prior podcast discussions, but the health impact pyramid, where essentially, if you want to make the biggest impacts in health, you address that socioeconomic layer. Because as a doctor, when you focus on clinical education with a patient, you're focusing on one-on-one kind of interaction, whereas if you're able to move the needle on social economic policies, you can impact a lot of people. And I think that's also why a lot of kind of clinicians and people in health get attracted to public health. And I think more and more during the pandemic, it was very clear that there were a lot of socioeconomic divides that shaped some of the health disparities that we saw. And essentially, these things that I was thinking about led me to money. And I don't think I actually grappled with that question before. What is money? And I was like, oh my goodness, this is a major determinant that could be helping everyone across the board support their protection action ability, for example, because as we know, for example, in health challenge situations or disaster situations, people that have more resources sometimes have more options to whether, let's say, an earthquake comes or a major maybe an earthquake is not a great example because it has such a short warning window, but maybe something more like a hurricane. And if you think of Katrina, for example, those that who weren't able to flee, for example, to safety beforehand, they were more at risk. And we were seeing these similar kind of patterns in the pandemic where folks had lower socioeconomic status, they had less resources to maybe protect themselves and stay at home more if they. And so I saw this as a way, Bitcoin as an economic tool that could support people's well-being in health challenges, whether it be an infectious disease outbreak or just being able to protect themselves with more financial resources to empower their health and healthcare journey. So when I made that connection in 2021, I just could not unsee it and just wanted to be an additional voice in the Bitcoin space to share these ideas and to share specifically how Bitcoin can be used as this tool in health, and the social determinants of health is another thing that I'm passionate about. So yeah, that's a brief. I think also too, like oftentimes before you go down the rabbit hole, you've probably heard of Bitcoin before. I'm not sure the exact date of when that was, but that's the most memorable story of when I actually took Bitcoin seriously.
Very interesting. Yeah, I've really enjoyed seeing the content that you're putting out in the Bitcoin space and bringing your background of health policy into the Bitcoin space. I'm curious, how has it been trying to bring this Bitcoin mindset into the health policy space? Because I know
Yeah.
in healthcare, ever since I went down the Bitcoin rabbit hole, it's changed the way I view medicine and healthcare. And it's most people that are in healthcare and medicine don't haven't had the same epiphanies that you and I have had about the money system and how that affects health. And so I'm just curious as to how that's been having this new Bitcoin mindset working in the job that you're working in health policy.
Yeah, it's been a fascinating road. I would say that in public health, we're in the business of trying to prevent disease and obviously to improve healthcare services, social services that shape a person's health. And so I'm in the realm of health promotion specifically, where essentially you're trying to help empower and enable people to make healthier choices. And it's a little difficult to make the connection for other people, other scholars, because the evidence isn't there. There's not these perfect clinical trials out there to show that Bitcoin holders, for example, have better outcomes. And you, as an internal doc, can just prescribe Bitcoin. It's not like that right now. It's a real grassroots movement. You have to immerse yourself in the community and also be open to finding the evidence that is out there. Again, it is very qualitative in nature, right? So I think both you and I have heard of or seen communities that have started living on a Bitcoin standard, and people are able to address some of their healthcare needs, right? There are programs, for example, throughout Africa, South America as well, where women are empowered to use Bitcoin and they can get pharmacy goods that they might need to help their baby, for example. There's a program in Kenya, I think it's Bitcoin for Babies. And there's other examples of this out there, but it's not in the main discourse in the health spaces. And so when you try and talk to people about this, they dismiss it if they haven't done their own homework. They might just revert to what they've heard on the news about Bitcoin. And it is quite difficult to share this message, but what really gives me hope is that there are wonderful students and I think people in the healthcare, health policy, social services space that want to do something different.
Mhm.
And Bitcoin tends to eventually find people. So there's more and more voices of people who are trying to explore this technology to improve health. For example, there's actually a student that I think heard maybe our last interview and reached out to me and asked how can they get involved? And I'll be meeting this student actually later this week to talk about how they can get engaged. So I think one thing is adding our voices to the conversation, and you just never know who might listen.
Yeah, I think we're part of this awakening, and society is starting to see a lot of things that were hidden for so long, and Bitcoin is central to this awakening. And it's nice to hear stories of people hearing the message and wanting to get involved. Because, yeah, Bitcoin it calls you at the right time. And yeah, each day, more and more people are hearing the message and being curious about it and awakening to the message. And in Bitcoin, we always say, fix the money, fix the world. And it's interesting how we apply the Bitcoin principles to our own lives and our own professions. Like I can see how a Bitcoin standard would be incredibly helpful and would fix so many things in the healthcare system, similarly to how you can see how Bitcoin would help things tremendously in public health. But I'm just curious, how specifically would things get better on a Bitcoin standard in the public health space?
Oh, wow, that's a big question. Yeah, so I think it's going to take time for adoption to happen. What is it? Like you see some numbers like 2 to 3%, maybe slightly
Mhm.
more of the world is actually using Bitcoin to some extent. And so I think also it's going to take time to trickle through to the healthcare, public health space. And what I think, or where I think Bitcoin could really help is at the individual level. And I think Bitcoin, it promotes this ethic of like individualism in the sense of you take control of your finances, but also take control of your life in general. And for most people, that is health is a very important part of that. And I think if more and more people can start saving in Bitcoin, especially I would say in the Western countries where that tends to be the predominant use case, then people might feel that they have more agency to seek maybe alternative options for a healthcare issue, for example. We know medical errors, for example, is a major cause of morbidity, mortality, and a lot of that could be corrected if there was more doctor patient communication interaction and also having an open relationship with your care team to seek other advice as well too. Often when you go outside, especially for example here in Canada, we have a quite universal system which is quite centralized, and it could be very hard to find additional options, and our wait times are worsening if you look at some of the data. And imagine that patient that might be waiting for that surgery could go to maybe a non-intervention remedy for what they're experiencing if that is an option, and they had the money to then explore that option, that could definitely improve health. So I think at the individual level, it could really empower the individual to take ownership of their health and have a variety of healthcare providers that could help them along their journey. So I really think it's in the individual level. And then once you have more people on that standard, then you're talking about community health, then that blows out to population health. It really starts at that level, I think.
Yeah, absolutely. I think we all see that when people get into Bitcoin, it's almost inevitable that they empower themselves, not just with their finances, but with their health. It just inevitably spills over into your health, where you see Bitcoiners just making healthier changes and eating healthier and taking things more seriously and also questioning things that they always thought were just handed down to them. Like in medicine, we often think about the food pyramid and we just accept it. But as Bitcoiners, you start to question things and think about the motives behind things. And I think it's really a huge part of the movement is empowering yourself and questioning mainstream narratives and just taking control of your own life. And it starts with taking control of your finances and then taking control of your health and then taking control of your thoughts. And so, yeah, it's this whole individual movement. And then once the individual gets empowered, then the community gets empowered. But I'm just curious as to how Bitcoin has personally changed any of your personal habits or any of your personal viewpoints on life and how it might have changed the way you go about living your life.
Oh, wow. I think it's changed my life tremendously. It has forced me to think about where I want to spend my time professionally, personally, and it has brought me more in tune to my values and trying to stick with those as much as I can. So, professionally, for example, I have shifted my focus to try and get this message about Bitcoin and health out to the world. And that's taken a lot of my time these days in writing, whether it's articles, mentoring students. And prior to Bitcoin, I'd be like, why would anyone want to do that? But to me, it just seems it is the under investigated determinant of health that we have not been focusing on. And professionally, I spend a lot of time on it. I also help people learn about self-custody methods of Bitcoin as well, doing community-based beginner education training. So I've really shifted my focus in that realm. And then personally, I try and put first things first. It's so easy, and I'm not saying I'm perfect at this at all, but really keeping that vision that I want for my life at the center of kind of what I do, and try and not get sucked into mainstream narratives around this is what you need to be doing, and really just thinking about, okay, what is it like? Where does my soul feel like it's being connected? Where do I feel like when I'm working, it's just pure bliss? Like, obviously, work is not going to be pure bliss all the time, but you're in a state of kind of flow. Like right now, this conversation we're having, I'm feeling it's just flowing. And I feel like this is the right place, right time, what I should be doing. And sometimes when you're working against your values, you're not in that space, and it's harder to find flow. So Bitcoin has helped me reorient my compass, I would say, and still trying to figure out the journey, like 4 years later or so, still figuring out where it's taking me, but I feel like it's in alignment with where I want to go.
Yeah, yeah. I always say that when you're on the Bitcoin standard and you get away from the stress of fiat, it frees up a lot of mental capacity and allows you to see things that you wouldn't have seen if you were stuck and stressed out in the fiat system. And when you can step back a little bit, you're better able to hear your intuition and see some of the signs that the universe is throwing out there that you would have otherwise not seen. And I think it's really inspirational how you're really leaning into your intuition and how you've actually allowed Bitcoin to take you wherever it's going to take you. And I think that's very inspirational because you had the path that you were going down and that's what you always thought you were going to do. But then Bitcoin led you to have this almost mini awakening. And now you've made real changes in your life, like living abroad. And I think you're basically embodying the shift that's happening. You're one of the pioneers of the shift. And as more and more people wake up, they're going to start living their life in similar ways to what you're saying and following their intuition more and not just going down this path that they always thought they were going to go down and questioning things. And when you question things, you can get more in touch with what your soul was really designed to do. And that's what I see in you. And that's what really draws me to you. And there's this concept in Bitcoin called proof of work. So you're actually doing what you're saying and putting in the work and actually contributing to the Bitcoin community and bringing the Bitcoin principles back to your job in public health. And it's super inspirational. But can you talk a little bit about how you were on this path and then now you're on a little bit of a different path? And I find that very fascinating.
Yeah, I would say I was in school forever. I'm sure you could appreciate that too, going undergrad, grad, doing a doctorate. And admittedly, I didn't know if I was going to go into academia right off the bat, but I fortunately had a track record of publishing, and it set me up very nicely to line up a faculty position right after finishing my doctorate. And naturally, I just thought, okay, I'm just going to continue along. And it took me to higher administrative positions, and very thankful for the opportunities that I've had. But once I discovered Bitcoin, it puts you in another paradigm. And you look at the current one that you're in and you realize, I think it's Jeff Booth that says this, and there's people prior to him that have said this, you can't fix a system from within the system. And You and I both know that there are these typical levers in healthcare and public health that usually it's like we need to pour more money into the healthcare system to improve it and improve health outcomes. But I think once you realize that monetary system is broken, it's like we're putting a band-aid on a wound that needs surgery. So it's like you just think about, you basically go into these professions because you want to help people, and you're seeing that what you're doing or like the knowledge that you're contributing to is just recycling the same information, and you really just want to step into something new. And that's the feeling like in my heart. And after like conducting lots of studies with like teams on various like health and public health studies, you realize, okay, we need to do something differently. Really do. And if I just keep doing the same thing over and over, what's that saying? You keep doing the same thing over and over. That's like and expecting a different outcome. That's like the definition of madness. And I feel like that's what we're doing in healthcare. And these are well-intentioned people, but often when we're trapped in a system, you only see so many options. And you're like, okay, something has to be different here. And yeah, from there, once I really started seeing it and couldn't unsee it, I really was just like, I need to. And admittedly, it's not easy at all because it's not like there are major companies in the healthcare space running a Bitcoin standard, or clinicians that are running their clinics on accepting Bitcoin. There's definitely some in the States and other places. But here, for example, in Canada, it's depending where you go, there's definitely some circular economies like in Calgary, I believe Vancouver, and maybe some other ones. But it's tough because you're going against the grain, and you need to try and then, okay, figure out how can I establish a way so I have livelihood, but at the same time I can help people as well too. So it's a great leap, uncertainty, but what I tell myself is I'm going to trust the process and see where it leads. And it has been awesome overall, I'll say, in that I've met amazing people like yourself. I would have probably never met you if I didn't start advocating for Bitcoin on other platforms. And yeah, so basically had to make the leap and seeing where it takes me.
Yeah. Yeah, I love hearing your story because it's very similar to my story. It's very uncomfortable to break away from what you thought you were going to do your whole life. In this space, you meet a lot of resistance and it's not easy. But similar to you, the calling is just so strong that we're both pushing past the discomfort and leaning into it and just seeing where it goes. And yeah, I'm so thankful to have met people like you. And that's what this movement is all about. That's what this awakening is all about. And it's happening at the right time because we've got the technology to be able to have these discussions. And yeah, we're just regular people that are feeling the calling and doing what we can. And every day, more and more people are going to be on the same path as us. And it's just going to just keep building and building until it reaches a critical mass. And it's pretty clear that Bitcoin is inevitable. It's going to happen. The Bitcoin standard is, we're going to move towards it. The fiat standard is just so broken. It can't last. It's not clear how much longer it's going to last. It could keep going for a little bit longer, but at some point things are going to move to that Bitcoin standard, and it's going to be very important for people like you and me and other people in the Bitcoin space to really think hard about what alternative systems we want to build. And so I'm really excited to hear your input and to continue collaborating. And is there any last words that you wanted to say on this podcast?
I would say I think an interesting development in, if we're calling this maybe decentralized health, like on top of Bitcoin, that there's just so many innovations happening and so many solutions, I'll say, in some respects. So if someone listening to this is new to Bitcoin and trying to figure out, like, does this Bitcoin thing have any relevance to like health, healthcare, social service? Feel free to join your local meetups and reach out to that person that might have written an article on the social benefits of Bitcoin, for example. Like, people in the Bitcoin space tend to be very friendly and open to collaborate. So I just encourage people to just explore that fascination and also come with an open mind as well too. I think, for example, Noster, notes and other stuff over relays, essentially is like this, I guess, decentralized, censorship resistant internet for social media and other communications. And I think the implications of Noster is fascinating. And there's healthcare and health related apps being built on top of that. So just encourage people to explore Noster as well. It uses the same kind of cryptography concepts of what Bitcoin uses. So things essentially are tied to this public private key pair, and you hold a private key or an NSEC in the Nostr world, and you can carry that data with you. So imagine, like, in the healthcare space, for example, having a patient that's really able to own their healthcare data and take that across their care continuum. I think an empowered patient tends to have better healthcare outcomes. So I think for those people who are looking for different solutions, Bitcoin and Nostr, I will say, again, Nostr is very early days, so we don't know where it's going to go, but I think there's lots of lessons to be learned. I just encourage people to explore Nostr as well.
And I've been really enjoying your content on Instagram with Dream Grad Academy. Can you talk a little bit more about what you're doing with Dream Grad Academy and what your plans are for the future with that?
Yeah, thanks for that. So Dream Grad Academy is a essentially an education startup that I started in 2024. And this is when I kind of decided I really want to do something related to Bitcoin and health. And the idea is that money is a determinant of health, and it is often a tool that we need to help support our dream lives. So that's the thinking behind Dream Grad. And I work with communities, for example, who are interested in understanding what Bitcoin is. So doing webinars and sessions. Sometimes on LinkedIn, I'll do free sessions of like kind of anyone that's interested in learning more about Bitcoin. So creating approachable, like, educational spaces where people can first start learning about Bitcoin. And I'm hoping we'll also be an approved node in the My First Bitcoin network so that we could just expand our educational reach throughout the country and Canada, and also because it's virtual. So anywhere, anyone that's looking for that foundational Bitcoin education. So the idea is for Big Dream Grad Academy to be essentially a node in this Bitcoin education space. So it's evolving. And then we've also have a partnership with bitcoinmentor.io. Some people might know BTC Sessions, one of the leading educators in this space. He founded this company with Mike Cook, a successful businessman in Canada, and recruited, I think it's 10 to 15 educators like myself, and we come actually from various backgrounds, some very technical, some like more like me, that's on the social side of things. And essentially, so the idea is that from this basic education that we offer at Dream Grad, if people are looking for more advanced or one-on-one hand-holding, I can help to support people with their Bitcoin self-custody setup, for example. Yeah, so we'll see where Dream Grad goes, but the idea is just to be just another node in the Bitcoin education network.
Great. Yeah, I really love seeing when you post stuff on Instagram, so I can't wait to keep seeing what you put out.
Thank
Yeah, thank you so much for having this discussion. I always enjoy our conversations and looking forward to our next conversation.
Likewise, yeah. And again, if there's anything that anyone wants us to talk about in the healthcare, public health promotion, health policy space, please let us know.
All right, we'll see you next time.
See you.